Ever pondered why a CT scan of the brain is often the first resort for doctors dealing with head injuries or neurological issues? It's because this remarkable technology offers an in-depth look into the intricate structures of the brain, helping medical professionals diagnose conditions, plan treatments, and evaluate the effectiveness of therapies. But how does it all work? Let's unravel the mystery together. A CT scan, or computed tomography scan, essentially takes X-ray imaging to a whole new level. Imagine slicing a loaf of bread. Each slice would give you a unique view of the bread's interior. A CT scan operates under a similar principle, but with the human body and in a far more sophisticated manner. In a CT scan of the brain, the patient lies down on a motorized table that slides into a donut-shaped machine. This isn't just an ordinary donut, though. It's an advanced device equipped with an X-ray tube that rotates around the patient's head, emitting a series of narrow beams through the brain at different angles. As these X-ray beams pass through the brain, they get absorbed to varying degrees by different tissues. Denser tissues like bone absorb more rays, while softer tissues like the brain matter or blood vessels absorb less. This differential absorption is detected by sensors on the other side of the head, which then send this information to a computer. The computer is the real mastermind here. It processes the data, converting the varying degrees of absorption into a detailed cross-sectional image of the brain. This image is essentially a slice of the brain, much like a slice from our imaginary loaf of bread. The resulting images provide a detailed view of the brain, allowing doctors to detect any abnormalities or changes in the brain tissue. A CT scan of the brain can reveal a multitude of conditions such as brain tumors, hemorrhages, blood clots, and even signs of stroke. It can also help in detecting and locating injuries to the skull. The information derived from a CT scan is invaluable in planning the right treatment approach and assessing the patient's progress during and after treatment. Summing it up, a CT scan of the brain is a non-invasive, painless procedure that uses X-rays to create detailed images of the brain. The patient lies on a table that slides into a donut-shaped machine, which emits X-rays through the brain from various angles. The absorption of these rays by different tissues is detected by sensors, and this information is sent to a computer. The computer processes the data and converts it into an image. This image helps doctors diagnose conditions, plan treatments, and monitor the effectiveness of therapies. So the next time you hear about a CT scan of the brain, you'll know exactly what's happening. It's not just a scan, it's a window into the intricate workings of the human brain, providing invaluable insights to medical professionals worldwide.